Hey everyone, welcome to the live stream today. We're Paso Manual Physical Therapy. I'm Dr. David Minoff. Thank you for those of you that have joined us live. Sorry, we're running just a couple minutes late. And I just want to tell you now, please type in the chat if you can hear me. I'm testing out a new microphone here, and I want to make sure I'll pull the plug on it if you can't hear me. Let me just type that in here. Type in the chat. Hear me, and tell me where you're from as well. And there's a massive windstorm outside our building right now, and here in El Paso, Texas. There's dust blowing everywhere, so I want to warn you in advance in case we get cut off, the internet goes out or something. We'll try to jump back on as fast as we can, but we might have unreliable internet today. I think it's working so far, so hopefully we are okay. Where you are from too. All right. So type in the chat if you can hear me, please. We already have a couple of comments here. I'm going to get to those in just a second, but I just want to let you know we're going to be talking today about the top 4 reasons for outer knee pain. So if you can hear me, type something in here. And I'm going to keep talking here about the top 4 reasons for outer knee pain. This has been a highly requested video that we've gotten. Everybody wants to know what are the causes of outer knee pain. And we've got some videos here and there, but I've never really put it all in one video. So I'll be doing that for those of you today, as well as taking any questions that anyone has. Hey, Grace from Tyler, Texas. You're on the other side of our state. Hopefully it's not as windy as it is over in Tyler as it is here. You got a lot of trees out there. We have nothing but dirt. It's in the desert in El Paso. So when the wind blows here, it is dusty. And Jazzy Spirit, I hear you. Hey, Jazzy Spirit. All right, so let's get to it, friends. This comment that we got on our channel here came on our video about inner knee pain. We've got a video about how to fix inner knee pain in 2 minutes. It's done very well on YouTube here. And we have Mr. Nolan Lewis that commented, what about pain on the outside of the knee? Is that also a tibial shift? And when he's talking about a tibial shift, on that video that I did about inner knee pain, here's the leg here. This is the thigh bone. It's called the femur. And then you have your kneecap right here. And then this is the tibia, the big bone here. And the little one out here is the fibula. So what I had talked about in that video that can cause inner knee pain is when that, get it to move over here, this tibia right here, can shift side to side. You see that little tiny wiggle? It's not much. There it is better. I'm trying to get a better angle on it here. So you would think, can it go outside as well as inside? We typically see it shift inside. I have seen it shift outwards, but it's just been a handful of times in my career, and it's something that we address and fix. And just like I showed you in that video to push your knee outwards, and you would push your knee inwards, but it's not that common. There's a lot of other reasons for outer knee pain. So that's why I wanted to make this video today to kind of clear it up. I didn't want to make a, fix your knee pain in 2 minutes video, your outer knee pain in 2 minutes video, because it just isn't as consistent of a problem as we see for the ones that are on the inside of the knee, the pain that's on the inside of the knee, and that shift that goes inwards rather than outwards. So I can't give you a specific formula or a trick or technique. My best advice that I can give you for outer knee pain is to guide you on what possible diagnoses that you might be suffering from, or combination in some cases, so that you can go and investigate it more and find some more specific help for that, whether it's here on our channel or somewhere else, or maybe you're seeing a physical therapist in person and you can educate them a little bit about what's going on in your body. So before I get to that, let's just get to some comments here. Some comments that started before, that were dropped before we started the video here. Dr. Mario Abrantes says, Dr. David, do extra buttock exercises can cause side effects as low back pain or tight psoas? Thanks from Sao Paulo, Brazil. Oh, awesome. Hey, Mario from Sao Paulo. I think he's asking if butt exercises or glute exercises can cause other pain like back pain. Absolutely, they can. And that's why the way that I coach, when you fire your butt muscles, you want to not fire other muscles, just the glute muscles. And you want to reduce the intensity at which you're firing those glute muscles so that you don't start to engage a bunch of other muscles, and don't put your body in an awkward position where you're going to overstretch something else like the front of your hips. That's a common thing that people do, is is inadvertently they're trying to work out their glutes and they end up stretching their hip or their groin as well. So you want to reduce the intensity so that you don't have any side effects. But I look at exercise as like a medication. Just like a physician would look at Tylenol as a medication, they're thinking about how it's going to affect how it's going to enter your bloodstream, how it's going to affect your cells. I'm looking at it mechanically though. How is this exercise going to affect your joints? How are the other muscles around in the area going to respond? How are the nerves going to respond? I think about that too. And if you take too much of a dose of, say, ibuprofen, there's side effects that come with it. You can tear a hole in your stomach. This is a known side effect that if you take ibuprofen consistently for weeks on end, your chances for getting a hole in your stomach, literally an opening in the lining of your stomach can happen, and you can die from it or go to the hospital. There's tons of people, hundreds of thousands of Americans that go to the hospital. Some of those die simply by taking too much ibuprofen. So that's pretty dangerous. That's way more people than like chiropractors injure from neck injuries. It's actually quite rare for a chiropractor to injure somebody from their neck, or definitely from physical therapy injuries. So Mario, just tone it down a bit when you're doing those glute exercises. That way you don't hurt other body parts. Annapurni PB. This is the next comment. Doctor, if complete ACL tear occurred, how long can we extend surgery and manage pain? And what are the precautions to be taken? Suggest a suitable brace. Oh, we've done a video on this already, Annapurni. I'll have to link it, or you know what? Let me see if I could drop it in the chat here. Hopefully you're ready to see it. Yeah, I do have it right here. All right, let me just copy and paste it in. I'm going to drop it. Boom, there you go. So in that video that I just sent right there, it has a brace that you should be wearing. You absolutely should be wearing a brace if you tore your ACL, or if you partially tore your ACL or injured your ACL in any way, put on a brace. You have to. You're not going to get better very fast without one. And then you have to just rest it and let that swelling go down, gain your motion back if you lost any motion. And as far as extending surgery, Annapurni, it really depends on your severity, how bad the knee is, your physical activity that you're looking to get back to. Maybe you can do without surgery. There's professional athletes out there that have torn their ACLs and have never had surgery and have done very well in sports. So it happens all the time that people can avoid having an ACL surgery. And I personally, here in the clinic, have seen people reattach their ACLs. Now, when I say that, that's just my hunch. I don't have an MRI machine here in the clinic. And I'm not personally an MRI machine, but I have good tests where I can check the ACL, and I'll check it on somebody who's come in with a fresh ACL injury and doesn't feel connected. And then through treatment and rehab over time, which includes wearing a brace, it feels like it's reconnected. But I've never had anybody go back to the hospital or to the imaging center to get an updated MRI to see if their ACL is reconnected. I don't know of any studies that have been like that, where they've done conservative treatment, physical therapy treatment, otherwise known as, and where they've seen a torn ACL pre-therapy turn into a connected ACL after. I don't know of anything like that, but I've seen it here in the clinic. We help people like that all the time, Annapurni. So let me just get to a couple more comments here, and then we're going to get into the content. Mercy Romero says, yep, I can hear you. Lots of outer knee pain. I'm so sorry, Mercy. We're going to help you out today. Miriam Roche, you're going to have to help me out with the pronunciation, Miriam. I see you here all the time. Thank you for joining us, Miriam. Hello in Ireland, and storms there too. I'm so sorry. Hopefully it's not dusty like it is here in El Paso. Rosita Meggs, good evening, Dr. David. I'm from Belize. Oh, I'm so jealous. I would love to visit Belize. I have knee pain for about 12 years. My knees hurt so bad I can barely walk. Please help. I'm so sorry. We're going to talk about it, Rosita. Then Miriam says, I've been doing butt exercises for months. No back pain. I'm so happy for you, Miriam. It's so great to hear about your success. And Karsten Nielsen, haven't heard from you in a while, Karsten. Jogging on the spot with big toe grasping around the ground like you taught us seems to fix both knee and hip problems. Great going, Doc. Great, awesome. Yeah, the feet are incredibly important, Karsten. You hit the nail on the head. And for those of you listening, even up with hip problems. I've talked about knees a lot on this channel, but feet are incredibly important for making sure that your knees are healthy as well as your hips and back. It's really all connected, to use the old cliche that everybody's probably tired of hearing, but the body's completely connected, and so each piece affects another piece. As indirect as it may seem, sometimes it may actually be related. And then Carson asks, can outer knee pain also be from outside edge of the kneecap? Is that the meaning of outer knee pain? When we're talking about kneecap pain, Karsten, usually we're talking about pain on the front of the knee. Anterior knee pain is what the medical term would be. Even if it's on the side, on the outer side of the kneecap, it's still kind of on the front of the knee. And so I'm not going to be talking about kneecap stuff today unless we get a specific question about that. And then Grace says, when I do the tailgate swings, should I also swing my knee replacement leg, or just the one I'm working on that's natural? Great question. I would do both. As long as it doesn't hurt your knee replacement, it just feels to me easier to swing them both, whether you swing them at the same time or alternating side to side. And it wouldn't be wrong, Grace, to just swing your normal knee, your natural knee, rather than your other one. But movement is good for the body. That's what it's designed to do. A replaced joint is designed to move as well. So I'd say move it, use your muscles, get the blood flowing, get your leg moving, please. All right, sorry for the delay. Let's get to this. I don't have a whole lot of time today with patients and all. So number one reason for outer knee pain, friends, is IT band syndrome. Now, this isn't a super common diagnosis, but from what I've seen here personally in the clinic, IT band syndrome is the number one reason why people have pain on the outside of their knee. Now, just to give you the information about IT band syndrome, I'm going to show you right here. The IT band, it starts up here. It's kind of, if you see the seam of my pants, that's about the outermost part of my leg and hip here. The IT band's more on the front. It's kind of on the middle side, outside of the leg, but it starts more on the front up here at the hip. And then that IT band runs all the way down past the knee joint and attaches right below the knee on the outside of the knee. There's a muscle up here called the tensor fascia lata muscle that's right about where your front pocket is if you're wearing pants like mine. And that muscle does attach into the IT band. The IT band's not a muscle. It is what we call connective tissue, which is the same tissue that ligaments and tendons are made of. So if you look at it in an anatomy picture like that one, it would be white rather than red. The IT band itself is white, but that tensor fascia lata muscle is going to be red, and it's just a little pocket-shaped, kind of rectangular shaped, teardrop-shaped muscle at the top edge of it. And then it goes all the way down into the side of your leg and attaches just below the knee joint on the outside of the knee. And IT band syndrome just means that you're overusing that tissue somehow, and it's become irritated, and it's usually at the outside of the knee. You can get it on the outside of the hip too, but it's really common, especially in people that are doing cardiovascular exercise, like walking, running, using a treadmill, using a bicycle, whether it's an outdoor bike or a stationary bike, elliptical. Depending on how you're moving, you're usually overusing that TFL muscle, that tensor fascia lata muscle that attaches into the IT band, and it begins to pull that IT band quite a bit at the knee, and it can cause that IT band syndrome. Whenever you hear syndrome in the medical field, they're clustering a bunch of different signs, but literally what we see is the IT band tissue is just overly irritated. Now, some interesting facts about the IT band is it's covered in nerves. And for the longest time, we didn't really know what it's for. We're still learning a lot about why it's there, and we give it, we say that it's proprioceptive in the medical field. So proprioception just means your awareness of your body in space. So that's what they think that the IT band is for. And I completely agree with that. I think that it makes sense given the location of the body and the way the legs move and the way the muscles, the design of the joints and muscles and body and all that. It makes sense to have this thick band that you can fine tune the rotation in your legs. So that's what the IT band is for. So learn more about IT band syndrome and how to fix it here on our channel. Go down to the description for this video here, and you'll find a link for IT band syndrome videos that we've made so that you can find specific exercises to help you out. And that's the case with just about every condition that I'm going to talk about here, except for the next one. And just a couple more points about IT band syndrome. It's most common in people under 40. That doesn't mean that if you're over 40, you're not going to get IT band syndrome. It's just that other problems tend to affect people over 40. And the people that are under 40 are usually the ones that are a lot more active. They're going to the gym, exercising, doing that kind of thing. And of course, it's not a hard and fast rule. I'm sure somebody's watching right now who's in their 70s or 80s or beyond, and they're on a bike for hours and hours every week, or running for hours and hours every week. I've seen them here in the clinic, but you're going to be the exception. You're not going to be the norm. So if we're talking about generalizations, it's usually people under 40 that get the IT band syndrome problem. Okay, so number 2, an LCL injury can cause outer knee pain. LCL stands for lateral or outside collateral ligament. LCL, lateral collateral ligament. So if we're talking about the knee, there's 4 major ligaments that we always talk about. There's actually more than that, but those are the big ones that everybody talks about. You have the MCL on the inside, that's the medial collateral ligament. You have your ACL on the inside right here on the deep within the knee joint. That's the anterior cruciate ligament. PCL is the posterior cruciate ligament. They're right on top of each other. They just run in different directions. And then the outer part right here, from the end of the thigh bone right here down to this little bone right here called the fibula, you have this LCL ligament that you can feel. It's a real thick band ligament in your knee. And typically this one gets injured with accidents. Like if you've been in a car accident, a bicycle accident, motorcycle accident, something like that, then it's going to potentially be stretched out or strained. So you would have a knee sprain or a knee strain. That's what would cause the LCL injury. And you could have ligamentous laxity, which can cause clicking, popping in your knee, and it can become irritated over time the more you're active. So if that's what you've got, just like the ACL problem that somebody asked about earlier, you've got to wear a knee brace to protect that ligament, because it's an important ligament for connecting your knee joint together. And if you don't have a bracketed brace to support it, then you're just not going to heal very well. So this one also tends to happen to people that are younger. But like I said, it's a generalization. You might be in your 60s and have an LCL injury. And it's not always an accident. You can technically have a chronic development of this. And it typically happens with people that are bow-legged, people that their knees are starting to shift out and they have a big gap between their knees. Because that ligament gets tensioned on the outside, it can become painful. So for that individual, you might use a brace to make sure that the ligament is not becoming irritated and overstretched. Okay, so that was number 2. I'm going to go to number 3 in just a second, but let's answer a few comments here. So we left off on Grace. Judy Pratt says, finally, that was my gut feeling. I'm not sure what you're referring to, Judy. Drop a message here and let us know a little bit more. And then Miriam says, turning my knees out when exercising always feels good. But what is the purpose of turning them out? Great question, Miriam. And then let me just see. Oh, Roche is pronounced just like cockroach. Great. So it's Miriam Roche. Beautiful. Okay. So then to answer your question, what is the purpose of turning the knees out? Really clear. Great question. So when you turn, what she's talking about is when I talk about firing your glute muscles, I tell people turn your feet out and turn your knees out just like this. When we talk about squats, you're doing them with your feet out and angled out like this. And the reason for that is because of the anatomy of the body. If we look at the hip joint right here, when you turn your leg out at the hip joint right here, the hip turns out. If the glutes attach from the top of this bone right here on the outside of the back of this hip pelvis bone right here, and they run down and attach to right here, when you turn your hip joint out like this by turning your feet and your knees out, it pre-shortens your glute. This is a principle in muscles. When you pre-shorten a muscle, it's going to work better. Let me show you another example. If you take your arm and we're going to test your bicep, and I gave you a weight in your hand and I said from an extended position, pick it up. It's just a lot more effort to bring it up from way down here. But if I give it to you right here, if I give you the weight right here, and then tell you grab onto right here and just move it a little bit, that's a lot easier for you to do. You can go through this motion easier because you've pre-shortened the muscle. You put it in a position to where it's going to work better. It's the same thing with the glutes. So when you turn your feet out and your knees out like that, and then you go to actively fire the butt muscles, you squeeze these glute muscles, they're going to just work better. And so you could test the theory out on your own. If you stand up right now and stand with your feet turned in and your knees turned in and try to fire your butt muscles, I'll show you what that looks like. So instead of toes out, point your feet in and knees in this way, and then stand up straight and squeeze your glutes back here. Tighten up, tension up these butt muscles with the toes in and knees in. And you'll feel them work probably, but not nearly as good as if you turn your feet out and knees out. Then they work a lot better. You get a much more efficient contraction, a better contraction. And so it's helping you out. It's putting you at an advantage to use your glutes better, Miriam. So I hope that helps you out, Miriam. Karsten Nielsen says, turning knees out may have to do with the way we are supposed to caretake our digestion and gut content while moving. That makes sense from my perception of the human body. I've never made that connection before. I'll have to think about that one. Cricket New Jersey says, love all the great tips you have given us. You've helped me so much with my knee arthritis. Fantastic. I'm so happy we've been able to help you out, Cricket New Jersey. That warms my heart. That's totally worth it right there. All right, let's go on to the last two, and then I'm going to wrap up here within the next 8.5 minutes. So the third reason for outer knee pain is going to be a meniscus tear. If you have a known meniscus tear, which is a chunk of cartilage, you have two pieces of cartilage, your inner and your outer meniscus that sit right on top of the shin bone, the tibia right here, and they cushion the thigh bone on top of the shin bone. If you tear the outer one specifically, it can cause pain on the outside of the knee. And I would venture to say if you tear the inner one and if you have an MRI and they tell you don't have a tear on the outer part of your meniscus, but you have a tear on the inner meniscus, but you have pain on the outside of your knee, because I see that, it's probably the mechanical problems that have happened. Think about it. If your meniscus is torn on the inside of your knee, it's not going to rest appropriately. Your bones aren't going to settle on each other properly. When we talk about congruency in the hip joint, the hip joint is a ball and socket joint, so it's a very congruent joint, but the knee joint is not that congruent. You see how it's not like a socket over the end of the thigh bone, but the meniscus kind of makes it that way. So if you tear the meniscus, you lose congruency and it doesn't allow the knee joint to move properly. And because of the mechanics, you might just end up having pain on the outside of the knee joint. Now, the way that presents typically in people is the pain will kind of come and go. You may get delayed pain that happens later on, like after you do some sort of exercise or after you've been on your feet for a while. It may not happen right then and there. You may also have pain right then and there, especially if you have that tibial shift. So it just is weird. The most common way that people know that it's going to be meniscus related is they've gone and had an MRI, and the MRI has shown that they have a meniscus tear. So I hope that helps there. Miriam says, thanks, David. That makes sense. Awesome, Miriam. I'm glad we helped you out. And then Cricket New Jersey says, my butt muscles used to be weak and now are strong because of you. I love it. You have no idea, Cricket New Jersey, how many people come into the clinic and are pleasantly surprised that they're going to get firmer, more toned glutes while fixing their knee problem or their hip problem or whatever is related to the problem that we're working on, that we're having to address their glutes for. Literally, I was just having the conversation with a patient last week on Thursday. And she was referred to us by another patient. And the thing that sent her over the fence to come in was, besides getting her knee addressed, her knee problem fixed, was that the person that sent her in has better buns. And so she said, I'm coming in. I don't have anything to lose. I'm going to get better buns at the very least if I don't get my knee fixed. And she's doing better. Her knees are doing fantastic now. And one more comment here. Oh, Maria Natara. Hey, Maria. She's from El Paso. I know you, Maria. Thanks for joining us on here. I appreciate it. All right. So one more reason for outer knee pain. This is probably the most common one for the older people here, over 50. So if you're 50 years old or even 60 years old, you're not that old. You still have plenty to go. But relative to the other diagnoses, you're going to have this problem more likely. Arthritis, knee osteoarthritis. I call it arthritis for short. There's different kinds of arthritis out there. I'm talking about osteoarthritis, and that's just changes to the bone on the ends of the bones where the joint attaches. The joint doesn't move the same. It should be nice and smooth in there to reduce the friction so that your knee can bend without making any noise. But if you've got a noisy knee, if you listen quietly to your knee and it's crunching and cracking in there, and you might even put your hand up there and you can feel the vibrations coming from the noise inside your knee, you likely have arthritis. And if you've gone to get an x-ray and they've told you have knee arthritis, they might show you some irregularities on the surface, or they might tell you that the spacing has decreased or that you're bone on bone in your knee joint. Then you might have outer knee pain because of this. Now, with the common imbalance that we see, the glutes being weak and the quads being over dominant, surprisingly, I'm surprised we don't see more arthritis on the outside of the knee. We tend to see it on the inside compartment of the knee. They split the knee into two compartments, the inner and the outer, because of the shape of the thigh bone right here. You can kind of split the two. But we tend to see more arthritis problems on the inside. And there's a lot of theories out there, nothing that's been proven, but just so that you know, you might be having outer knee pain because of knee arthritis. So that covers the big four. Now, a notable mention, so kind of like a 4.5, a 5, I wouldn't really count this, but you could get hamstring tendonitis. The hamstring muscles, let me show you myself, they come in, the hamstrings attach right kind of on the seat bone, right on the bottom of the butt. And then there's 3 muscles that go down. 2 of them go outwards and 1 goes inwards. Or I might have that backwards. Somebody can correct me. But you have sets of muscles that go outwards and inwards right here. And so when you are doing too much activity, and specifically you start to break down in that hamstring tendon, there's a tendon that goes on the outside of your knee. You can feel it. If you just bend, if you're sitting down and you grab behind your knee, you'll feel a tendon that you can kind of rub over right here. That hamstring tendon attaches into the outside of your knee, just below the knee joint line, so kind of in the same area, and that could get irritated for some people. If you have that, you've probably got other problems too, like you might get sciatica along with this, or hip pain or back pain associated with this, but you can technically get hamstring tendonitis. I've only seen it a few times in my career. It's not something that is super common. You're way more likely to suffer from a meniscus tear, arthritis, IT band syndrome, or an LCL injury than you are from hamstring tendonitis, but it's a possibility as well. So that covers my 4 reasons for outer knee pain. I hope this was helpful for you, friends. Let me answer the rest of the comments here. If you have any questions, I'm about to sign off here in the next couple of minutes, so ask them now. Karsten Nielsen says, BPC-157 seems the healing peptide from heaven. What do you think about that? Do you advise clients to use it? You know, I don't know about that. This is the first time I've seen that, Karsten. You are educating me quite a bit. I can't comment on it. I don't know about it. I'm so sorry. I can't recommend it to people if I don't know about it. Carl Rhodes says, I have sciatic and awful knee pain. Please tell me what to do. I do not want surgery. Oh, Carol, that is a lot, Carol. That's a very a loaded question. The best thing I could do, Carol, is point you to our sciatica playlist. Excuse me. There are tons of videos there that help you with stretches, exercises, concepts, strategies. There's a lot. There's different types of sciatica. I don't even know what you have going on. Based on how you pinch the nerve, you might have more sciatic pain on the front of your leg, or it might affect more your foot or more your thigh. You might have the more classic presentation where it goes into the butt area and down the back of the thigh. Sorry, my throat's itchy. And so it really just depends on how you present. There's certain things that you might do that might hurt you rather than help you. So you got to be careful. Excuse me. That my best advice, Carol, is to go look through those videos so that you can apply it to yourself and see what's going on in yourself, and choose from there what might be best for you to do. And then my other recommendation would be, if you can get to a specialist around you, who treats sciatica. I'm a manual therapist. I would have great confidence in seeing another manual therapist. Then go see one of those people, because they're likely to help you out best, most directly with sciatica problems. The one thing that I'll tell you on this right now is the most common problem I see with sciatica is this pelvis bone shifts. It can go this way or this way. And that's especially the case whenever people go to the doctor and they get an MRI or an X-ray and they determine that nothing's going on in the spine. The patients will come back often saying something like, well, my MRI is clear. The doctor said they can't help me. There's nothing for the surgeon to do. They just sent me home with pain medication. But they're here in the clinic in agonizing pain. They can't sleep at night. The pain medication just took off the edge, and they're saying there's nothing that they can do. So here we diagnose that pelvic shift and how it can compress the nerve. So I hope that helps you out. Miriam says, thanks so much, Doc. Really appreciate you. Oh, thanks, Miriam. I'm happy to help. You're always a plethora of information. You're so welcome, Miriam. Karsten says, BPC 157 is really promising as it seems to heal even bad cases of cartilage tears very fast and great. Just another comment came in. Still needs physiotherapy to correct the problems that cause the tear in the first place, so do not fear from your job, doc. I'm not. Medications are great and wonderful, but the mechanical part of these body aches and pains that I talk about on this channel all the time are so underrated in the medical field. Nobody talks about them. People go straight to surgery, medications, injections, painkillers, all that kind of stuff. That's why I made this channel, because I know that nobody's talking about it. So I wanted to be a voice talking about ways to naturally heal things that make sense, that aren't just, like voodoo things, snake oil things. I'm only going to bring things that really work to you guys. I don't want to, push things that are just unknown or don't have any good reasoning behind them, good deductive reasoning. All the stuff that I talk about here on the channel, I'll tell you if I recommend it, and if I tell you, I've said it on this channel, there's mixed research on this. There's some people support this, some people do get better, some people don't. I'll be straight and honest with you. And then there's some things that I'm black and white about, like strengthening your glutes. You better strengthen your glutes if you got a knee problem or a hip problem, and you better look at your foot strength too. That's another one that I probably need to harp on a bit more. Grace says, thank you. Carol says, thank you. I wish you were here to be my doctor. Oh, Carol, I wish I was there. Were you the one in Belize, Carol? Maybe I should go out and visit you. I think that's somebody else. Carson says, medication is a sleeping pillow, and teach people not to fix what caused the problem. Yeah, that's exactly right. It's passive. Taking a pill, taking a supplement, having a procedure done, getting an injection. You don't learn. Your body doesn't figure out how to fix the root problem. That's the drum I've been beating this whole time. So 100% with you. And with supplements out there and medications, I always tell people, don't rely on it. You can't. This isn't cancer. It's the way you've been moving. And if you go get that operation done and you're still moving the same afterwards, you're gonna have problems eventually again. Poonam Java, outer knee pain